Today I'll be speaking on the subject of high blood pressure, some of the causes, ways that we can regulate it, and things that will be beneficial to us for our body. High blood pressure is when your blood pressure is higher than normal for an extended period of time. Sad to say, it has been called a silent killer. Most time, it is not detected until a physician discovers it. It has been said that it is more prevalent in senior years, past 64. Sad to say today, mostly in African Americans. But it is also known to have affected the young as well as the old. People over the age of 55 with normal blood pressure have a 90% risk of developing hypertension in their lifetime. It's simply because your heart is working harder than normal to pump blood through your body, and you can't feel it. This is why it is called a silent killer. Untreated, it can lead to a greater risk of stroke or heart attack. Frequent blood pressure monitoring is very important. If you have been diagnosed with high blood pressure, you should have it checked regularly. It is manageable with a lifestyle change that includes exercise as well as medication. Patients with high blood pressure should be and overall careful because it can lead to diabetes along with high cholesterol. It can be controlled by making dietary changes, such as limiting salt intake, cease from smoking, and increasing our daily activity. During your exam with your physician, he or she may use this blood pressure cuff that wraps around the upper arm and is attached to a bulb to check your blood pressure. Then he or she listen to a stethoscope. The sound of blood passing is heard through it. The first pound is called a stochastic blood pressure, and diastolic blood pressure is when the doctor can hear sound anymore. A normal blood pressure reading is less than 120 over 80, and a high blood pressure reading is 120 to 139 over 80 or 89 and above. The cause for high blood pressure is unknown. Many times it could be in a genetic form. But some of the risk factors are being overweight or obese. As I said before, family history, diet, along with stress. There are no symptoms unless the pressure is really high. For a long time, then damage may occur in major organs such as the heart, kidneys, and brain, causing small vessels to burst in the eyes. According to Dr. Matoba, a family physician, treatment for high blood pressure are beta blockers and calcium blockers. You should make healthy choices while taking your medication, and this will help lower your blood pressure. While normal news reports that there are 4 types of herbs that will lower your high blood pressure. They are garlics, serpentine, hawthorn, natural news reports that most medications prescribed by physicians have side effects also. This speech today is to inform you and I on the dangers of high blood pressure and some of the ways that we can treat it and the causes in which it occurs. Thank you so much.